Hi everybody, we're back again at the ACF Central Office here in DC, although our presenters are far-flung. We're just going to do a few quick logistical announcements and then we are going to get rolling. First of all, you have probably noticed or heard that all of the lines for participants are muted. It's so that we don't get any random background noise throughout the course of the webinar, but it doesn't mean that we don't want to hear what you are thinking and what you are wondering. So please feel free to send your questions and comments in through the question box throughout the course of the webinar. We're hoping to have a few minutes at the end to address some of those questions and comments. Finally, we have already gotten several questions about the PowerPoint presentation and the webinars that were previously held in this series. All of the ones that are previously held are currently in the process of going up on the ACF website. As soon as the webinars are up, we will post the link. We will send out the link via email. The same is true of this set of slides. We don't know how long it'll take to make them ACF compliant, but as soon as we have them compliant, they will go up as well, and we will certainly keep you all in the loop on that. Without further ado, I will introduce, for the fourth and final time in this series, the Policy Advisor for Early Childhood right here at ACF, Chantal Mee.
Thank you, Tricia, and thank you all for joining our last webinar in our series on preventing expulsion and suspension. So today's webinar is going to focus on using data systems to track and reduce expulsion and suspension. A quick overview of today. I'm going to give you, after I finish with the overview, we're going to hear some framing comments from James Berg-Kadima from the Office of Civil Rights at the U.S. Department of Education, and he's going to jump in to their data collection efforts on suspension and expulsion in pre-K. We're then going to hear from two different states, Washington and Connecticut, on their data systems. And then we're going to have Dr. Walter Gilliam from Yale tie it all together. For those of you that joined the first webinar, you'll remember his name. And then we're hoping to have a few minutes at the end for questions and answers. Even if we don't get to your questions, we definitely have those in writing through the chat function. So if you've been on any of the other webinars, you're very familiar with this slide. We like to set the context for why we're focusing on expulsion and suspension. Everyone on the line likely knows how important the early years are to children's development and later outcomes. We know that expulsion and suspension often happens to the kids who need intervention the most, and instead of supporting them, we're expelling them from the system. We know that there are a whole slew of negative outcomes from expulsion and suspension from school-age settings. We also know that early expulsion predicts later expulsion, and so as Walter has mentioned a few times, if it's being used as an intervention, it's not working. The other two things that are really alarming that have really focused our attention on the issue is that some estimates have found that the rates are actually higher in early ed than in K-12 settings. And of course, all data has consistently found, anyone that's really looked at the issue, that there are really big racial disparities with young boys of color being expelled and suspended at much higher rates than their peers. So given that, we worked with our partners at the Department of Ed, and we set up a framework, a certain set of pillars or principles that we think are really important to reducing and preventing expulsion and suspension. The webinars have largely focused on different areas here. Today is going to, as I mentioned, is going to be on really setting goals and tracking data, and there's a few different ways to do that depending on your state. But without further ado, I'm going to pass it over to my colleague at the Office of Civil Rights at the U.S. Department of Education, James Berg-Kadima. James?
Great. Thank you so much. Good afternoon, good morning to wherever you may be listening live or in the future recording. I've been asked to do a couple of things, and I hope to get through it as efficiently and quickly as possible. I think the time for conversation and questions, I look forward to that. But here at the Department of Ed from the Office of Civil Rights, I've been asked to walk you all through OCR's civil rights data collection efforts, particularly our most recent public findings from 2011-2012 academic school year, a bit about the CRDC methodology of how that data is collected and produced, some of our most recent pre-K early education findings, which is a new issue for us in our collection efforts, and then walk you through a quote-unquote not quite live, but a good sense of what it would be to navigate this public database. It's a tool that we intend for the public to navigate in your local communities, so by school or by school district, to find tailored information of what may be happening in your own backyard. And then lastly, leave you with a series of resources that speaks to some of the federal documents that are out there that might be value added in combination with a look at data. So next slide, folks. Great. So what is the CRDC? The Civil Rights Data Collection is definitely a complex, wide-ranging data collection effort that we use to measure the equity health of our nation's public schools and districts. It's long-standing. It's rooted in some of the statutes that the Department of Ed at the Office for Civil Rights enforces, including Title VI of the Civil Rights Act, which provides protections on race, color, and national origin, Title IX, which is gender, and Section 504 of the Rehab Act, which provides disability protections in schools. It is something that is collected every 2 years. And for the most part, it's a sample universe, but the 2011-2012 collection was a universal sample. So we have close to near 100% of schools responding in this collection effort. Next slide, please. The Secretary of Education definitely sees that data is an essential element for starting and triggering and inspiring greater attention to the inequities in our public schools. So we view the CRDC as a tool. It definitely shines a spotlight on successes that are occurring within districts across the country and challenges. And moreover, it provides the user, whether it is a researcher or a layperson, a parent or community advocate, with the ability to do a tailored sort of self-analysis of what's happening in their community. So for us, it's a starting point. It's a spark for a dialogue. By no means is it the beginning and the end of assessing a problem, but it's sort of a good tipping point of what might be out there. Next slide. So we've taken an effort, this collection has been around for decades, and we've taken efforts in recent years to make it, freshen it up, revamp it. And so the CRDC at present is bigger than before. It's more detailed, comprehensive, and more accessible to the public. Next slide. This is what our past prior collection efforts looked like. It was very researcher-friendly. Academics loved it. All of these sort of charts and files, which prevented this information actually being useful in communities. Next slide. So with a lot of efforts and a lot of transition, we have moved over into a dashboard approach. So users to the CRDC, this is how they enter the database that we have and all the data held within. The web page is ocrdata.ed.gov. You'll hear me repeat it several times, but simply typing that into your browser will take you to the dashboard. We've tried to make the new goal for the current collection and display is that it's simple, it's intuitive, it provides data that prompts exploration, conversation, and change, and it's flexible enough to still satisfy the needs of researchers and academics while intuitive enough for the average public. And next slide, please. Ultimately, our hope is that we're translating complex data into a story for the average person. So the 2011-2012 is the current collection that is public. I do want to say that the 13-14 effort is still underway, and we're about to begin the 15 and 16 effort soon. So there's always several collections underway, and there's a lot of process built in, which is why the latest and available data to the public is the 11-12 collection. So I told you that it's near universal sample. We had over 16,000 school districts, 97,000 schools, and 49 million students represented in the information collected. We also include a non-traditional education setting. So while it's not just our K through 12, we also include juvenile justice facilities, schools for blind and deaf students, and alternative schooling. The response rate is rather high. In the 2011-2012, we had a response rate that represented 99.6% of all students in the nation, and almost all the information is presented and disaggregated by race, ethnicity, English learner status, sex, and disability. And for the very first time in 11-12, we actually asked some basic questions around preschool enrollment, and preschool discipline, more importantly, to today's conversation. Next slide. So one caveat. So we collect all this information, but in the preschool space, a couple things need to be noted. We're only, the CRDC data collected and available to the public is only for school district operated programs in the preschool space. So this would not include private preschool programs and programs not run by a school district. And more importantly, many of our school districts around the country are organized in the secondary level. So many school districts aren't represented in the preschool information that we have, given that they're not focused on the elementary or the early ed range. So, we don't essentially collect any information on the quality of these programs. We just have basic enrollment and discipline trends for those preschool programs operated by school districts. So here's what I would offer. So for the average school district that is submitting this information, they are doing it through an online collection tool, either through a web-based interface or they're doing it through a flat file. The collection is done in two parts. Pretty much it's a fall snapshot and then a cumulative or end-of-year snapshot for different metrics that we are collecting on. So there's two different points in time that information is submitted. And throughout the process, there are embedded edit checks. So before the local official can submit the information, we have quality controls for outlier, numbers that are entered into the system, et cetera. And at the end, there's a robust effort to certify and to check and engage for accuracy. Next slide. So some limitations on the information that's available through the CRDC. It's definitely self-reported, and so the accuracy depends on the information provided. And there's some privacy protection notions built in. So there's a bit of rounding for student groups of 3. So for example, a student count of 1 to 3 is rounded to 2, and a student count from 4 to 6 is rounded to 5. Next slide. So all of this information we've collected in 2011-2012, what does it tell us about preschools? A couple notions are pretty prevalent. Public preschool access is not yet a reality for much of the nation. About 40% of our schools do not offer preschool programs. And there are some racial disparities, as mentioned before. Suspension rates for preschool children are pretty shocking, and I think that was the biggest report out from the 11-12 collection. Black children make up 18% of school enrollment, but 48% of preschool students, children suspended, about 40% of those suspended at least more than once, and 42% of those suspended once. So the one racial category that is disproportionately represented in suspensions in the preschool arena happens to be African Americans, and particularly it's clustered around boys. Next slide. We also have some interesting other ways to display data. We take a look at disability status. And here it's there's some evidence for students served by IDEA, one of our special education laws, that there's proportional representation in the suspension, the single suspension and the multiple suspension. Almost proportional, a little less than their share of representative sample. Next slide. And we do the same sort of display for English learners. Students who are considered limited English proficient. They're 12% of the preschool population, and they're proportionally, comparably around the same range for a single incident of suspension and multiple incidents of suspension. Next slide. So these are just some of the displays that are available through a dashboard. We make a dashboard available to the entire public. Off of any search that one does, you get these interesting summary of select facts. Off and to the right of those select facts, you get great drill downs on early childhood preschool enrollment, district early childhood preschool suspensions, and expulsions as well. Next slide. One more. Great. So a user would, at ocrdata.ed.gov, would get this portal. You click on the orange link. Next slide. And if you're curious about your community, you just would search by district or school. You have the tabs at the top. And then you enter the geographical. You can do by zip code, name of the city, name of the school, and run the search option. And next slide. And you'll get this sort of link to the, in this case, it's a district search. If you notice up and to the right, you can export it to Excel and get the flat file, or you can click on the link. And for a lay user, when they click on the link, next slide, They get all sorts of information about the characteristics and makeup of the school. Next slide. If they scroll down, often to the right of some of the basic information presented by district or by school, there are these additional reports in the early education space. So the early childhood enrollment data is available off to the right. Next slide. And a little further down, there's a lot on preschool discipline and corporal punishment. And if this were a live interface, you could click on that, and immediately all of the tailored information for that school or district will be pulled up in a high graphics interface with simple explanations for the public. So next slide, please. At the end, we hope that data informs the conversation. So there's some joint resources from Ed and HHS that we released that I wanted to bring to your attention. The last slide will have links to these documents. But the Office of Civil Rights at Ed, we've produced a snapshot. So many of the high graphics, the sort of national trend data is housed in this sort of document to the left for you. It provides kindergarten retention rates broken down by race and ethnic groups and comparisons across states. So offering a sense of which states are providing greater full-day offerings in the preschool arena, particularly those run by school districts, and then have high enrollments of children with disabilities and high enrollments of English learners. And then the document to the right is a joint document from Ed and HHS, which is recommendations to prevent and limit expulsion. So getting at a solution. If the data shows that there is a disparity, it's worth a conversation and it's worth a community engagement. And so the document to the right, that is in the spirit of offering ideas and resources to prevent and limit expulsion, suspension, and practices in the early education setting. And last slide, folks. Everything that I've just mentioned now, here are the links to them, to the CRDC website, to the sort of snapshot on early education, the resource document, the joint HHS Ed preschool discipline statement, and then some greater resources on discipline in general. So outside of the early education context, we have a landing page with all the resources and ideas that are out there to sort of prevent disparities in discipline. So with that, I'm going to turn it back over, and I thank you so much.
Thank you so much, Jim. Next, we're going to have Dr. Gail Joseph from the University of Washington give us a good description and overview of how Washington is working with expulsion and suspension data. Gail?
Okay, great. Thanks, Chantel. So I've been asked to talk a little about some data collection efforts on child care expulsion in Washington State and how we've used that data to inform professional development activities in the context of our Quality Rating and Improvement System, or QRIS. So before I begin, let me just say the role that I play here. So I'm a faculty member at the University of Washington and have been involved in some of the work on both the kindergarten entrance assessment and quality rating and improvement systems in Washington State. So I'm going to talk about it from that perspective. So that is to say that this is not yet a statewide data system. And I also want to acknowledge that we don't have it right yet, but we do have a start, I think. So next slide. So just some background in Washington State. Child care expulsion has been on our radar for a little while now. I know that there have been several dissertations on kind of small n scales. And I just want to talk about some relatively recent work. So in 2009, we were asked to conduct an evaluation of our state's kindergarten entrance assessment pilot, which was called WAKIDS. And as part of this study, we surveyed parents of children who were entering kindergarten in schools participating in the WAKIDS pilot. So just over 2,500 surveys were sent by mail to these parents, and about 1,700 were returned, so about a 67% response rate, which is great for a mail-out survey. And the survey included many questions about children's experiences in their early learning setting prior to kindergarten, but it also included whether they were ever asked to leave a program due to problem behavior. And the results indicated a removal rate or expulsion rate of 16.7 per 1,000. So it's important to note that also a majority of the parents who indicated that their children were asked to leave a program also reported high mobility. So they reported that they had moved 3 times or more between birth and kindergarten entrance. So it's possible that their child was asked to leave more than one program. We don't know. We just asked about one time. So this provides us with some information about expulsion across early learning programs because these children were served in many programs. They were in Head Start, they were in state pre-K, they were in child care, they were in private child care, etc. and that expulsion rate seemed pretty high to us. Now, at the same time we were working on the kindergarten entrance assessment pilot, we were also evaluating a pilot quality rating and improvement system in the state. So there was a small-scale pilot in 5 counties, and we had a team of assessors collecting data and participating in child care programs, as well as collecting data on how child care coaches were spending their time. And we were hearing anecdotally from our data collectors concerns about challenging behavior and about the quality of the experiences for children with special needs, in particular those with challenging behavior. And we were seeing notes from coaches that indicated similar thoughts, that there were some concerns about challenging behavior for sure, and how a few children in each setting were experiencing childcare. So we noted in our 2010 evaluation report that a next iteration of the quality rating and improvement standards should take individual child experiences as well as positive behavioral support into consideration. So next slide, please. I'm sure that most of you are familiar with the logic model for quality rating and improvement systems, but for those who are not, I just offer this quick overview to provide some context for my presentation. So first, in the red square there are quality standards that are developed, and these typically include looking at the environment, the interactions, curriculum assessment, staff development. And these standards really drive the assessment or data collection of the quality of the experiences in these child care programs. And this is important because, as we know, what we choose to assess will end up getting a lot of attention. So that data informs the green part there, the star rating or level of quality. And the results of that star rating, then in the purple square, would drive that demand for quality from providers and parents. And then the data would be used to create program quality improvement plans and professional development opportunities. And then, of course, it's assumed and hoped that if these things align, the result will be improved child well-being and school readiness. So what we assess as quality is pretty important because it drives this entire system. Now, after the pilot of QRIS and as the state was applying for the Race to the Top Early Learning Challenge grant, we had an opportunity to draft some new quality standards and assessment protocols for child care. And then bearing in mind our concern about children with special needs and in particular children with challenging behavior, we set about creating a quality assessment protocol that would include a focus on their experiences. So we used commonly used measures such as class and environmental rating scale that focus on general classroom level of quality, including social emotional support, but we also had this idea that we were going to use this focal child approach, kind of born out of the research literature, to ensure that not only is the program providing high quality experiences in general, but that any one child who was selected randomly, maybe a child with challenged behavior, that we could look at their experiences from their perspective, so kind of this bottom-up perspective. Do they get greeted warmly? Is the teacher noticing when they're having difficulty in responding in a timely fashion, et cetera? So at some point while we're working, I'll tell you this so that you don't do what we did. So at some point while we were working on this protocol and testing it out, we just had this dreadful thought that if early learning providers were worried we might randomly select the child who's demonstrating some challenging behavior, regardless of the etiology of that behavior, that we unintentionally made children with special needs and children with problem behavior a perceived liability in these programs, and that we might just, in fact, be complicit in increasing rates of expulsion in the name of improving quality child care. And that is definitely not what we wanted to do. And we indeed were hearing from child care providers that they were, actually saying out loud that they didn't want to go for their quality rating until they could remove so-and-so. And so we definitely had a problem there. So we decided we needed to send a message that you are not NOT, a quality program if you're kicking children out. So while we still collect a lot of direct behavioral observation data, we do now also collect data on child care expulsion, because remember, what we choose to measure gets attention. So next slide, please. So at this time, when we collect data in our QRIS programs, so these are child care programs and any early learning program that is electing to participate in the quality rating and improvement program, this is what we say. If no child has been removed from the program within the last year, or if there is a no expulsion policy with evidence that is followed, then the quality point is automatically given. So we're actually giving points if you're engaging in not expelling, if that makes sense, if you're keeping children in your program. If a child has been removed from the program, so here we want to make this important distinction, I think, between expulsion, which is the parent shows up and they're shown the bite mark on the other child and told not to bring their child back the next day, so this like just complete expulsion, and we want to make a distinction between that and what we might think of as a supportive referral for into a more supportive place. So if a child has been removed from the program within the past year, we need to see at least 3 components in a written policy and documented practice to award the point. And some of the components include referrals to a more supportive program, referrals to Child Find, parent meetings, documentation of visits to other programs with parents, expert evaluations, documentation of the supports and challenges, and information on where the child is now. So we're also collecting data and awarding points on the use of positive behavioral support to decrease and prevent challenging behavior and promote social emotional development. But I'll speak about that in a few slides here. So next slide, please. So regarding child care expulsion, here's the data from about 18 months of data collection. And I want to make an important note here. So unfortunately, when we asked the question in these 18 months of time frame that I'm giving you the data, we asked about if a child has been removed in the past 5 years. And part of this is that we're trying to kind of connect it a little bit to the kindergarten entrance assessment data that we had. So we're asking about the last 5 years. That's the data you see there. And our current procedure started January of this year is in the last 12 months. So here we see that 56% of family child care programs reported having removed a child due to problem behavior, and that 69% of center-based child care. So this is probably not surprising to many people, and especially since we've given them that kind of long 5-year time span. And again, we don't know who this is or how many. We just ask if this has ever been an occurrence. Next slide, please. So then remember, we also ask about a no expulsion policy and policies and procedures in place that would refer to a program with more support. So it's not this kind of just expelling with shock and awe, but instead a gentle referral if indeed the program doesn't feel like they can provide enough support. So here we see that only 18% of family child care had such a policy and practice in place, and 33% of center child care had a no expulsion policy and practices in place. And again, many limitations to this data, and we're working to refine it, but we do think it's directionally correct and hope that it serves to send a message to providers that high quality programs do not expel children. So next slide, please. So even with its limitations, we have identified that providers need support, and I'm sure everyone listening knows that. They just need some more support, and we've been addressing this in a few ways in the context of our quality rating and improvement system. So we have used this data for good purposes to help prevent challenging behavior and to provide more supports for child care providers and early learning professionals. So next slide, please. So first, this is our house framework that we use in Washington State Quality Rating and Improvement System. This reflects our quality standards, and for the purpose of this presentation, I'm going to highlight at rapid speed the elements of positive behavioral support that you see. So while we're looking at data, while we're looking at child care expulsion, we're also looking at the extent to which there is positive behavioral support in place, and that's counting towards their quality rating. So you are a quality program when you have a good positive behavioral support programming in your center. So at the foundation in that green, we're looking at engaging interactions and environment. So here we're looking at programs that are well organized, there's good behavior management in place, it's warm and responsive, there's a positive climate. If you look at the blue pillar, we look at curriculum and learning opportunities and including social emotional here. So is there a social emotional curriculum being taught in the program? In the red area, we're looking at the extent to which they have screening and referral, as well as ongoing assessment of the whole child in collaboration with families, including social emotional, so parents are getting information about that on an ongoing basis. At the roof, the blue roof there, we're looking at the extent to which the program can demonstrate that they individualize based on this assessment data, which may include positive behavioral support plans. The purple siding, we call that the strong siding that keeps the house in place there. We look at the extent to which there's training and mentoring of staff, including practice-based coaching on positive behavioral support. And the yellow door, which talks about our family engagement and partnership standards, here we're also collecting information about the extent to which an evidence-based parenting program is being used in the program or in which parents are that's being made available to them. So next slide, please. So based on the data that we've collected thus far on the house, as well as child care expulsion, we again know that providers need support. So here are some of the ways that we've been providing some of the support. Participating programs get access to a coach, and the coach actually gets access to expert consultation. So if the coach is running into a child care program and there's some challenging behavior that they're not quite sure how to help support, they can call the University of Washington consultation team and get some support with that. All of our coaches are trained on practice-based coaching, on positive behavioral support, on cultural competence, on resiliency and wellness for adults, and they all complete internships at the Herring Center at the University of Washington, which is a model demo program for inclusion. So they also get extensive training and support on how to include children with disabilities. We also provide early achiever institutes throughout the state. I'll say something about those in a second. And we ensure that positive behavioral support is in our higher education programs throughout the state. Next slide, please. So our Early Achiever Institutes, these are 4-day professional development institutes offered at very low cost. Anyone participating in the Quality Rating Improvement System can attend one, and they're located throughout the state. And there are sessions on positive behavioral support, on individualizing, and on resiliency and wellness of the adults so that they can take care of themselves to take care of children. We also make available training on the positive parenting program from CEFL, and folks walk away with all the materials they need to be able to facilitate those back in their programs. And there's lots and lots of practical application and materials that they can take, and we have this make and take room where they can laminate visual schedules, create solution kits, develop social stories, all of those things that they can take back to their program immediately and help supporting those children, preventing challenging behavior, and increasing social emotional development. And last slide, in terms of higher education, not only is this in our credit-bearing college education courses on positive behavioral support, but last year we ran a MOOC, we ran a massive open online course through edX. This is a free course, a 9-week course on positive behavioral support for young children. It will be offered again on March 17th, so it's absolutely free. Over 20,000 folks enrolled in it last time, and this is something that we made available statewide to any of our early childhood providers that wanted to take it. And so with that, I'll turn it over to Chantel.
Thank you so much, Gail. So next we have Elizabeth Bicio from Advanced Behavioral Health, who's going to talk to us a little bit about Connecticut's early childhood mental health consultation data system. Elizabeth?
Okay, thank you. Hello, my name is Liz Bicio, and I'm the Director of Connecticut's Early Childhood Consultation Partnership. ECCP is an early childhood mental health consultation program. The ECCP, next slide. Oops, sorry. Go back to develop, sorry. The ECCP was developed and is managed by Advanced Behavioral Health, a private nonprofit behavioral health management and information technology company. Our funding is provided by Connecticut's Department of Children and Families under Children's Behavioral Health. The ECCP statewide program provides universal access so any child birthed through 5 can receive ECCP services through their caregivers. The goal is to reduce the likelihood that a child is going to be suspended or expelled from their early care education settings, and we do this by building the capacity of their caregivers. The program model is manualized, evidence-based, and supported with a custom centralized information system. The program model includes 3 levels of service, child, classroom, and center, and includes community and state systems consultation. Next. ECCP was developed in 2002. State funding from Connecticut's Mental Health Strategy Board was provided to Connecticut's Department of Children and Families to address gaps in child mental health services. One of these gaps included a lack of services geared towards young children under the age of 5. At the same time, there was also growing recognition that young children were being expelled from the early care and education environments, and that this instability was impacting their social emotional development. The Department of Children and Families in Connecticut is responsible for children's mental health. They issued an RFP for a statewide system of early childhood mental health consultation, and in this underscored the importance of having a results accountability framework to ensure quality services. ABH applied through a competitive process, was awarded the contract. In our application, in our budget proposal, we included that we would develop a model of early childhood mental health consultation that also included an embedded information system. Cost for the maintenance of the information system are included in our annual budget, and they're supported by our funder, the Department of Children and Families. The ECCP service model and ECCP information system were designed simultaneously. Myself and an IT programmer worked together in this design process, ensuring a shared language across information technology and also human services. Next slide. ECCP's initial funding was for a period of 9 months. The scope of the work was to implement a statewide system of early childhood mental health consultation and to secure funding to sustain it. Through the information system, ECCP was able to effectively demonstrate that those children receiving services and who were identified to be at risk of suspension or expulsion, 99% were not suspended or expelled from the early care or education environments at the 1-month follow-up date. Later data would show that 97 to 98% were not suspended or expelled at the 6-month follow-up. For the next few years, we were able to secure additional dollars from the strategy board, also bridge dollars from private foundations and some dollars from the Department of Education while we worked with state leadership to embed ECCP within the state budget. Later, our funding was doubled, which was supported by our outcomes and Walter Gilliam's expulsion study. Also around this time, ECCP engaged in a rigorous random control treatment trial evaluation that demonstrated ECCP's impact on the children that we serviced considered to be at risk of suspension or expulsion. This further supported the need for the consultation program and strengthened our position in Connecticut. The ECCP information system was an important component to our stability, sustainability, and growth. It also allowed us to expand rather seamlessly. Next slide. The ECCP information system is housed at Advanced Behavioral Health. The ABH Information Technology Department manages the application and maintains the platform environment. It's accessed remotely through the web, which allows for more portability. The system is extremely secure and has industry best practices to protect the privacy and confidentiality of the information. The user end requirements include that the consultant's home agency, computer, and internet access, and also have Wi-Fi connectivity. The EIS is comprehensive, centralized, and interactive, supporting our statewide network of consultants. Next slide. How it works. First, the purpose of the EIS is to collect data for program operations, report on outcomes, and also support our continuing quality assurance. Next slide. It's menu-driven, and the menu is consistent with the ECCP model features. Next. It collects demographic information at every service level and information related to outcomes, goals, referrals, and service visits. It also collects information about suspensions or expulsions, such as how many children were asked to leave because of behavior over the last year. The system clearly defines data fields by limiting the type of data that can be entered, such as dates, using drop-down lists and limiting free text boxes. All of these aid in collecting statewide data that's consistent and helps to effectively communicate about our impacts. Next slide. The EIS system uses a combination of data sets to understand and report on the intended service populations. For example, gender, ethnicity, date of birth, city residence, parent, guardian, marital status, child care funding source. They may all help to clearly define a particular population that the program is intended to service and then report on it. Next slide. Our experience and lessons learned with the ECCP program over the last 12 years has supported the evolution of the ECCP information system. It supported better ways to ask questions and record responses to get the most accurate information. For example, how do we define expulsion, and what are the consistent time intervals we ask this question? Here, the EIS system defines what expulsion is by also defining what it's not. We asked the question about the child's status in the classroom at the 1-month follow-up date and have included all possible responses in the drop-down list. These range anywhere from graduated to new grade to being expelled. Next slide. The EIS model fidelity feature guides the consultant's work through the structure of the ECCP service model. This is an adjunct to the supervision they receive. Next slide. Data is used seamlessly to guide the quality of the work of the consultation. The EIS has built-in goals, objectives, and a section for individualized strategies and outcomes. This data is based on feedback from the clients and used to create an action plan that's printed by the consultant and shared during their action plan meetings with the teachers and families. Next. The EIS looks at pre- and post measures to establish baselines and provide information for the work. It also evaluates and informs about the impact of the work. Next slide. The EIS produces a number of reports based on the needs of the consultant or the director of the program. The system enables us to look at data from different vantage points. For example, the system has the capacity to look at an individual child and also has the capacity to look at all of the individual children served. And it allows us to look at the data across different time frames. Overall, it helps us to understand more about the populations we're servicing, the context and the environments that we work in, and also the impacts of our work. Next slide. This is an example of a consultant-level report and action plan as described earlier. Next slide. Here's an example of a payer-level report which shares information about statewide contract goals through aggregate data on outcomes, numbers served, community involvement, workforce development, and also on the statewide rates that we're able to maintain the children we service from being expelled. Next slide. There's many benefits to an information system. The system provides uniform and consistent as well as comprehensive and timely data collection and reporting. And this is useful to helping inform state leadership and policymakers. It supports consultants' adherence to the model and continuous quality improvements to the model. The remote access to the system and centralized management of the ECCP model allows the service model to be effectively implemented across large geographic areas or even transported and implemented in another state or county. This has included benefits of the built-in model guidance and allows for more efficient and cost-effective service startup. This has been instrumental to our work with ECCP in New York through Nassau Thrives and Docs for Tots. The system supports a program to be research ready with a clear working definition of the model and the capacity to coordinate service and research activities. Related to results-based accountability, the system provides more sophisticated data than simply numbers served and includes tangible and measurable definitions of quality. Excuse me. Answering the question, are they better off answering that with the data? In terms of next steps, what can other states or counties do to support the development or adoption of a data system for their program? They can look to develop their own with an information technology professional. They can hire a consultant to aid their existing information technology staff or department in developing their own. They can hire an agency with programming and human service experience to develop software for their program, or they can look to purchase a consultation model that has an embedded information system. Next slide. In closing, there are traditionally two primary ways to communicate about our work in human services, communicating what the data is and telling the story behind the data. An effective data system is better able to tell the story using the data. It's an investment and not an expense. Thank you.
Thanks so much, Liz. And now we're going to hand it over to Dr. Walter Gilliam from Yale to tie everything together. Walter?
Thank you, Chantel, and hello, everyone. You just heard from three terrific presenters who made wonderful points about data collection, and my job, fortunately, is not to add to their points, but rather to try to tie them together, as Chantel had just said. Next slide, please. So you see here 7 questions that I came up with as you're thinking about how you might want to collect within your own state data on expulsion and suspension rates within early childhood care and education programs. Each one of these 7 questions I'm going to go through in turn, and so you can take a look at them right here, but you're going to see them again in a second. Next slide. So the first one is, how do you define the issue? In other words, how do you define what an expulsion is? What is an expulsion? What is a suspension? First off, there appears to be no clear consensus definition as to what an expulsion is or a suspension is or other types of curtailment of services. Within school districts, different states differ in terms of their ways of defining what an expulsion or suspension is. Some states say that an expulsion is anything more than 3 consecutive days of exclusion. Others say anything more than 10 consecutive days of exclusion. And so as a result, it creates a bit of a challenge. Secondly, there's many ways that services can be denied to children. Services can be denied to children either short-term. An example of that might be when a teacher calls a parent and says that the parent must come early and pick the child up from the preschool program or the child care program, and then the child is able to come back later on, maybe the next day. A more long-term might be if the program were to say that because of this challenging behavior, this child may no longer be able to go to the program for the next day, 2 days, 3 days, 4 days. All the way up to permanent removal from the program, where the director or the teacher might meet with the parent and say that this program does not appear to be a good fit for the parent and the child may not be able to attend. There's other types of restrictions too that might be possible, such as instances where a teacher might say to a parent that the child's behavior is so challenging that the child may only attend the program on Tuesdays and Thursdays between the hours of 1 and 3 when Miss Sally is here. So there's a lot of different ways in which programs might limit the amount of time that a child is able to be in the program as a result of the challenging behavior. There's also the possibility of something that some people refer to as soft expulsions. Soft expulsions being not when a program says that the child may no longer attend, but rather encourages the parent maybe to voluntarily terminate their services by consistently making hints to them that the child's behavior is problematic, that other parents are complaining, maybe by consistently asking the parent to come and pick the child up early from the program to such a degree that the program is no longer a viable source of child care for the family. And so that might encourage some families to actually just voluntarily terminate the services themselves because of the challenging behaviors. In some settings, it may not be, it may be a formal process, and in other settings, it might be an informal process. In other words, in some settings, there might be a whole procedure in place by which the teacher or the director meets with the parent, they try out certain things, they document exactly what the next steps are going to be, and there's a written record of it. But it's also quite possible that in some of our early care and education settings that the whole process of an expulsion or a suspension is rather informal, that the teacher just meets with the parent and says that this is what's going to have to happen, or the director meets with the parent, and as a result, there might not be any written record whatsoever of the fact that this child has been excluded. Not all settings are familiar with the educational terms of expulsion and suspension too. Expulsion and suspension are terms that are used primarily in public school settings and in private school settings, and it's not necessarily clear that our child care programs would understand what an expulsion or suspension is, or even use those terms to define what it is that they would be doing with children if they were excluding them from participation in the program. Next slide. So when taking all this together, first recommendation would be to perhaps avoid using terms that might mean different things in different settings. So in other words, instead of saying, have you expelled a child in the past 12 months, rather describe exactly what it is that you're talking about. For instance, during the past 12 months, have you ever required a child to permanently terminate participation in your program because of a challenging behavior? In this case, we're not using the term expulsion, but rather we're defining it. Or in this case, during the past 12 months, have you ever required a child to not attend your program for 1 or more consecutive days because of a challenging behavior? In this case, we're not saying suspension, but we're rather defining it in a way that perhaps most programs would be able to understand. Next slide, please. The next question is, who do you ask this question of? And so when you're collecting data on expulsion and suspension programs, expulsion and suspension rates, you could ask this question to an administrator, you could ask it to teachers, you could ask it to parents, there might even be other people that you could ask it to. The OCR data collection was asked of administrators. When I collected data on national expulsion rates back in 2005, I was surveying teachers, and we heard in Washington that the survey was of parents. And so it certainly raises the question that perhaps different reporters might provide different types of answers or different types of rates depending on what it is that they would actually have access to in terms of their knowledge of whether or not an expulsion had actually happened. For example, an administrator, it's quite possible that if there's an informal process going on by which children are being excluded from the programs, that perhaps the administrator doesn't even know that an expulsion had happened. And so if we ask an administrator, it's not necessarily clear that the administrator would even necessarily have record on this. Teachers, if they feel it is a poor reflection on their behavior or management skills, or they're engaging in some kind of soft expulsions, it's quite possible that perhaps they wouldn't report these as an expulsion either. Parents, of course, it raises the question of when you're surveying parents, would they be too embarrassed to answer the question? I think in the end, it doesn't really define that there's one particular reporter that's better than the other, but rather that there's probably limitations involved with whichever reporter that we decide to go with when we're collecting these data. Next slide. Recommendations for whom to ask. First, be aware of the potential limitations for the reporter you're asking, and then interpret the data and the rates that you calculate with those limitations in mind. If it's possible, it might be worthwhile to ask multiple reporters, but that might not be something that's actually feasible, depending on the way in which the data are collected. And also consider making behavioral challenges an option for regular data collection. In other words, when children withdraw from a program because maybe of an inability to pay the tuition or because of transportation challenges, perhaps one of the options in regular ongoing data collection for withdrawals would be that they withdrew because of a challenging classroom behavior. That might be one way to be able to access that. Next slide, please. So, what programs and teacher characteristics predict to data collection? Several characteristics of programs and teachers have been shown in different research studies that have been conducted to predict the likelihood of preschool expulsions and suspensions. In some of the research that I had conducted, type of setting, group size and ratios, the length of the day, in other words, how many hours the program is open per day, and access to behavioral supports were all things that were related to the likelihood of an expulsion or suspension. Likewise, teacher job stress and depression are related to expulsion and suspension. When teachers report elevated levels of job stress, they're far more likely to expel. And so these become potential things that you also might want to ask if you have the ability to be able to collect those kind of data. What other types of responses have been tried prior to the expulsion or suspension? That certainly might be something that would be worthwhile to know. Was the expulsion or suspension the first line response, or was this a response after other things had been tried and failed? The types of characteristics that you may collect depend heavily on who is reporting it, obviously. And some of the data may already be collected from other sources. In other words, if you're embedding your data collection within a QRIS system, you may already have access to some of these data points within that system. Next slide, please. Likewise, what child or family predictors might be worthwhile to collect? We've already heard that child race, gender, all predictive of the likelihood of expulsion. Also age. In mixed-age classrooms, we know that 4-year-olds tend to be more likely to be expelled than the 3-year-olds. And so it might be worthwhile to, when you're collecting these data, collect the data on expulsion and suspensions with concomitant data collection on the race of the child, the gender of the child, and the age of the child in comparison to other children in the classroom. There's emerging data to suggest that the quantity and the quality of the teacher-provider to parent-family contact may be related to expulsion and suspension rates, such that when there's high levels of high-quality contact and communication between the home and the preschool program, the likelihood of an expulsion seems to be much lower. And so if there's a way to collect these kind of data, it might be worthwhile, too, in terms of being able to understand better what things might be driving or what things might be protecting against expulsion and suspensions in your state. It would be useful to know whether the child had been previously expelled or suspended. That's certainly something that could be woven in as a question. It would be useful to understand better the specific child behaviors that usually prompt the expulsions and suspensions for young children. This is an area that we don't really have a whole lot of information on, except for a few relatively small studies. It would be certainly useful to know when a child is expelled, exactly what kind of behavior was that child engaging in that prompted that expulsion. Next slide, please. And then how do you capture the disparities based on race and disparities based on gender? Disparities in expulsion and suspension rates based on race and gender are well documented. They were documented in studies that I have conducted, other people have conducted, and most recently the Office of Civil Rights. There may also be disparities based on disability status and home language, family income. Although these weren't found in the OCR data for nationwide, it is possible that within certain communities these might be worthwhile. And so as a state, it would be certainly something to consider whether or not you want to collect variables along those lines. To calculate the disparity rates, however, you need to know the characteristics of the child that was being expelled or suspended, as well as the same characteristics of the other children in the classroom. Just knowing that the child who was expelled was a boy doesn't help you unless you know roughly how many boys were in the classroom versus how many girls. Same thing for race and gender. So you'd have to have both sides of that equation in order to be able to compute out disparity rates. Much of these data may have already been collected on children in the programs, probably through QRAS systems if those exist in your state, or maybe other mechanisms. And so by weaving these questions into extant data collection systems, you might be able to link your expulsion data back to other data that you already have on the characteristics of children in the classrooms. Next slide, please. Next, what services help? We need data on the problem, but we also need data on potential solutions. And so as states are hopefully collecting data on expulsion and suspension rates, it would also be useful to know within those same programs whether or not the teachers had access to services such as early childhood mental health consultation, CEFL, positive behavioral supports. The things that you would want to know are, one, do these services even exist within the program? Are they accessible? Do the teachers and parents know that they exist? If they exist but nobody knows that they exist, then there's probably not much of a likelihood that they're going to be actually utilized. Are they adequately supported and of high quality? Were they accessed, these support services accessed prior to each and every expulsion and suspension? And were they accessed equally well for all children and families? Or were some children afforded positive behavioral supports before an expulsion and some children perhaps not, and skipped over that process? These would be important things to know, but we're not going to know them unless we start collecting data on it. Next slide, please. Another question that you might be curious about is whether or not the rates of expulsion and suspension are becoming better or worse over time. And likewise, whether the disparities are becoming lesser or greater. In order to be able to know that, we would need to have data collection that's simple enough that reporters are going to provide us reliable information, probably through weaving that, again, through extant systems that might be existing within the state, and then trying to minimize any changes in these definitions over time. The more we change the definitions and the way in which we ask questions, the less our ability becomes to be able to look at long-term trends in rates, because we've actually changed what it is that we're measuring. Next slide, please. And so in summary, preschool expulsion and suspension is not a child behavior. It's an adult decision. But if we want to be able to change the decisions that the adults are making regarding children's ability to be able to access programs, then we need to be able to provide them viable, workable solutions, such as early childhood mental health consultation and some of the other ones that I've mentioned before. We can only address the problems that we see, and there's many invisible problems in the world, but there's no reason that expulsion and suspension preschool children needs to be an invisible problem any longer. We know how to collect data on this now, and when we start to collect data on this and collect more robust data, then we make an invisible problem a visible problem, and then we're able to work towards solutions. To know whether or not we're making progress, we need to measure both the problem as well as access to possible solutions, and to see whether or not when programs are given access or greater levels of access to solutions to the expulsion and suspension problems, such as early childhood mental health consultation, CEFL training, positive behavioral supports, whether or not that seems to be making an impact in the change of rates of expulsion and suspension over time, as well as making these data a regular ongoing part of data collection that's happening already within the state. I think the last thing that anyone would want to do is to try to think of another way in which we can ask teachers or program administrators to provide data to us when we could potentially just weave a few questions into already extant data systems, and in the process of doing it, be able to link the expulsion and suspension data to a whole host of other data that we would have available through those other data collection systems. So that's all I have to say in terms of some things to think about, and I thank you for your time and attention to this really important topic. Chantel?
Thanks, Walter. Sorry, we had a little blip with the screen here. I just want to thank our presenters so much for providing such valuable information. Data is incredibly important, and it's going to go hand in hand with any solutions to really address the issue of expulsion and suspension. It allows us to highlight the problem. As Walter mentioned, we can't address a problem that's invisible. It allows us to track our progress and to improve our services, and it really allows us to make the case for more services and supports to eliminate expulsion and suspension. So I know we're at about time. We can take a question or two if folks want to submit them in the chat function. We will have a list of all folks who are online and some of the questions, so we could also address them after the session. So one question we got a little bit earlier for Jim, if he's still on the line, is the CRDC data included, do they include charter schools as well?
The quick answer is yes, we do.
Okay, great. And then another quick question for Liz on the Connecticut data system. Is it a proprietary system or is it a public system? What's the question?
It's a proprietary system that goes hand in hand with the consultation model. That way it just ensures fidelity to the model.
Great. So with that, we got several questions on whether the slides will be available online. And as Tricia mentioned at the beginning, all of these are undergoing 508 compliance and different procedures so they can be posted online. You can expect them in the next few weeks, roughly. And just in closing, I've provided my contact information for other folks who have questions. And thank you to all of you who have joined and are really making efforts across the country, in your states and in your communities, to really help bring an end to expulsion and suspension in early childhood centers. And thanks again to our presenters who spent a lot of time preparing for this and sharing their insights with us today. So with that, we will close out the series and post these slides online soon. Thanks and have a great day.